Thank you very much for joining us today. Mahao, you may begin.
A good afternoon, distinguished guests, colleagues, and partners. And welcome back to our Erudite seminar series, co-hosted by the Institute for Security Studies and the African Union Development Agency. I am Mahao from the African Union Development Agency's Africa Policy Bridge Tank, and I'm so excited to be hosting today's discussion and being its moderator. Now, let me start with one simple premise. There is no pathway to prosperity without healthy populations, and no health without water. Yet across Africa, both systems are undergoing strain, from climate pressures and rapid urbanization to persistent financing gaps. Now, today's discussion is about confronting that reality, but also about identifying where the biggest opportunities lie. Now, drawing on the latest African Futures projections, we'll be asking three key questions. What does the data tell us about where Africa is heading? Where are we falling behind and why? And most importantly, what must change now to alter that trajectory? Because ultimately, this is not just an sectoral issue. It is about human capital, economic resilience, and the future of the continent itself. Ladies and gentlemen, I now have the pleasure of inviting Dr. Jakkie Cilliers to present key findings from Africa's Health and WASH Forecast Report to frame today's discussion. Dr. Cilliers, please, the floor is yours.
Thank you very much, Mahao. Appreciate that, and always a pleasure to partner with you and with AUDA-NEPAD. I'm going to share screen and try and capture a very complex issue in as brief a period as possible. So I'm sharing the front page of the African Futures website that we host in partnership with AUDA-NEPAD. And I'm going to navigate in the themes to our health and WASH theme. And I'm going to go to what we refer to as a slider. Everything I show you is on the website, and all the charts and so on is also in the website. So just a reminder of what we do to those that have not attended some of the Erudite series. So we forecast Africa's current development trajectory at the bottom. And then we model, amongst others, 8 sectors to look at their impact on the development potential. These sectors are demographics and health, which we're going to deal with today, agriculture, education, manufacturing, infrastructure and leapfrogging, the full implementation of the Continental Free Trade Area, inward financial flows, and better governance. And these give you a synergistic effect. So therefore, in the combined scenario, we really look at what is the development potential. And we do this at individual country level, and then we aggregate that to look at the region or Africa as a whole. So because humanity comes from Africa, the continent has a particularly high disease burden. And we are still at the moment, Africa's infectious burden of communicable diseases is much higher than our population share. And we explain this and the reasoning behind this on the website. So this is a chart that shows on the left-hand side, sub-Saharan Africa, in the middle, North Africa, and on the right-hand side, it shows the world except Africa. And this is a forecast from 2023 till 2043. You can immediately see that the burden of non-communicable diseases in Africa is much lower than the burden of non-communicable diseases in North Africa or in the world except Africa. And this is exactly the point about the high burden of infectious diseases that Africa has. What is also important about the picture that I'm showing you is that Africa is rapidly approaching what we refer to as a double burden of disease. In actual fact, it is more or less happening at the moment that the burden of non-communicable and communicable diseases are becoming more or less similar. So that double burden of disease is going to be quite difficult for the continent, because dealing with non-communicable diseases is much more expensive than dealing with communicable diseases. And this double burden of disease is certainly going to challenge the continent. And it will doubly challenge us because our spending on health is significantly lower. The average per capita spending in the rest of the world is about 15 times higher, and we import about 90% of our vaccine needs. So huge problem in terms of responding to this high burden of communicable and uncommunicable diseases. We face a similar challenge with water, sanitation, and health access. So this chart shows Africa versus the world except Africa. It is again from 2023 with a forecast till 2043. The reason why we use 2043 is that is the end of the third 10-year implementation plan of Agenda 2063. So the extent of safely managed sanitation is much lower in Africa. It's basically 29.5% compared to the rest of the world, where it is at 64%. So huge problems. We can see even the extent of open defecation in Africa is significant, and it hardly exists in the rest of the world. So big problems in terms of our disease burden, where we're approaching a double burden of disease, as well as our wash facilities. Two issues have really affected Africa in recent years. The one, of course, is the HIV/AIDS burden. And what this chart shows us is the life expectancy in North Africa, Sub-Saharan Africa, and the world except Africa. This is from 1980 on the left-hand side until with a forecast till 2043. So at the height of the HIV/AIDS burden on Africa, it meant that life expectancy in Sub-Saharan Africa was about 6 years, well, before HIV/AIDS. Life expectancy in Sub-Saharan Africa was about 6 years lower than it was for North Africa, and now it's about 12 years lower. So HIV/AIDS continues to have a devastating impact on the continent. We are now, where are we? About 2026. So life expectancy has recovered, but we haven't fully recovered from the impact of HIV/AIDS. The second pandemic, of course, is that of COVID. Now, COVID, what this chart shows, this is from 2020 with a forecast till 2024, and this is the cumulative deaths per region due to COVID. And what we can see, so this is for Oceania, Africa, Asia, Europe, North America, South America. This is Africa at the bottom here. COVID had very low mortality in Africa, but the impact on, for example, extreme poverty was much, much higher. So we expect in our forecasting that about 20 million more Africans will be classified as extremely poor due to the impact of COVID by 2030. About 20 million more Africans. So the economic impact of COVID on Africa has been huge. So in response to these challenges, we developed a scenario and did forecasting for every individual African country. And this chart shows you what we did. So the premise is that a large and healthy working age population enhances contribution of labor to economic growth. So at country level, we intervened on, increased contraception use, decreased under 5 child stunting rates. We increased access to safely managed water and sanitation. We decreased the most important communicable disease mortality rates and the most important non-communicable disease mortality rates, and increased government expenditure on health. And you can look at the outcomes and the impact on the right-hand side. Now, we did this at an individual country level. And this is a picture that shows you what are the disease types that we intervened in. We intervened only on the most important disease type per country. Just interesting to see the extent to which respiratory infections is your most important communicable disease at the top there, and cardiovascular, a non-communicable disease, which of course very expensive to treat, is the most prevalent non-communicable disease. So after we've done the scenario, we realized the huge effect that this has. The return on investment is simply massive. Propelled by a smaller population, remember we intervened on contraceptives, spending an additional 64 billion on wash infrastructure from 2023 till 2043 translates into $150 billion lower health expenditure. So you spend $64 billion, your return on investment is $150 billion. It shows the huge impact that better health and wash facilities have in Africa. So almost more than a doubling of your return on investment. These are some of the impacts. Let me just make the point without going into too much detail. What this shows is the impact for a number of selected countries. South Sudan, Central African Republic, Chad, Sierra Leone, Mali, Somalia, Lesotho, Nigeria, Burkina Faso, and Guinea. So, for example, here, this is the impact of HIV, of infant mortality rates in South Sudan in 2023, before we do our interventions. So, about 84 deaths per live births. By 2043, on the current path, our expectation, as things are now, it would decline to about 45, 46. With the scenario that we model, it will decline further to about 35. So, and you can look at these countries individually. If we look at Sierra Leone, it goes from about 64. It would have been reduced to 34 by 2043, but with a scenario, it further reduces to 27 deaths per 1,000 live births. Life expectancy, again, the impact that we've modeled. So this is from 2023 till 2043. The top line is the European Union, followed by the scenario for North Africa and Sub-Saharan Africa, with and without the scenario. You can see that in North Africa, we would see life expectancy increase, to 76, from 76 to 78 years, for example. This is the impact of that scenario on extreme poverty. So investing in better health and water and sanitation has an impact across the field. So on the left-hand side is a number of people in extreme poverty with the scenario, on the current path, the business as usual forecast, compared to the scenario. So whereas on the current path, by 2043, 533 million Africans would still be in extreme poverty. The health and wash intervention would see that decline to about 492 million. So huge. On the right-hand side, you can look at the poverty rate. To conclude, a productive economy requires a healthy and appropriately educated population, but we have the highest disease burden globally and low levels of education. Of course, higher education translates into better health. In recent years, HIV/AIDS has had a dramatic impact on mortality life expectancy, but the economic impact of the COVID-19 pandemic far outweighs its effects on mortality. Remember, I showed you that chart that showed this difference. Then we are particularly concerned about West Africa because of the density of humans, poultry, pigs, and ruminants that may become a hotspot for zoonotic pathogens. Sub-Saharan Africa is rapidly approaching its epidemiological transition, this double burden of disease. While communicable diseases are coming down, non-communicable diseases are increasing, and this is more expensive. It would require more expenditure on health. And there is significant scope to advance health and wash, delivering large benefits. And these are some of the recommendations. This is my second last slide. We need to invest in resilient community health systems. We need to scale digital health and surveillance tools. We need to embed climate resilience in health and wash infrastructure. We need to expand access to safe water and sanitation infrastructure. We need to accelerate regional health and self-reliance. We need to accelerate regional health self-reliance, strengthen regional data surveillance and laboratory networks, mobilize innovative finance for health and wash, increase domestic government spending on health, align health and wash strategies for demographic and green transitions, and promote regional cooperation and knowledge sharing. And I'm glad that a colleague from the CDC is also on the call. Mahao, thanks very much for that. I think I've more or less stayed on time.
Thank you so much for that data-rich and insightful presentation, Dr. Cilliers. I'd like to now invite our distinguished panelists to reflect on these findings, drawing from their respective institutional and practical perspectives. To this end, I would like to first invite Dr. Merawi Aragao, who is the Head of Surveillance and Disease Intelligence at Africa CDC. Dr. Merawi, please, the floor.
Thank you, Mahou. Thank you.
In no more than 5 minutes, if I may, Dr. Merawi.
Yeah, sure. Thank you. Thank you, Dr. Jack, for the nice presentation. I think this is very dense evidence that we have. I just want to reflect on one or two things. One, I think we have been struggling with, as Africa CDC, we are dealing daily with health emergencies across the continent. And over 70% of these outbreaks in the continent are global are in the continent. And of this significant amount are really challenged with poor health infrastructure, poor water and sanitation, and poor medical countermeasures across the continent. And one point that you mentioned, I think a critical measure that that has transformed global public health was water and sanitation before even the era of antibiotics and others. And that was really a big gap in our continent because we tried to shortcut it with antibiotics and so on, without developing huge infrastructure in the continent. That is really catching us up now. Every year in the continent, we are reporting disease outbreaks like cholera. I can give you, like, in 2023, over 225,000, in 2024, over 250,000, and in 2025, over 325,000 cases of cholera were reported from 19, 20, 24 countries across the continent. This is what we are really daily dealing with, and cholera is a mere indicator for a development agenda. It's not really a public health issue. And we are trying to patch the leak in the system, but the main driver is WASH. And it doesn't end there with mortality, but it has all the consequences with poor productivity and economic downfall. I think, and this report is really very rich. We need to have a very close look into it and come up with a really strong policy brief moving forward for our principals, the political leadership, so that they should invest. And for cholera, every year we have this magnitude, and without mentioning all other vector-borne diseases that we are dealing in, the malaria, the dengue fever, and so on, which are climate-related and other factors. But just to funnel it down towards the time of this discussion today, I think one important investment that we need to do or advocate for is the WASH infrastructure. And that is really the bedrock for economic leap. I think if we want to really move to the next level, I think that shortcuts that we did with antibiotics without developing infrastructure was the one that is catching us up now, that we need to reinvest back again into the system. Just to keep within the time, I think let me stop here. Thank you, Mo. Over to you. Thank you so much.
Thank you so much for the succinct reflections, Dr. Marawi. I now have the pleasure of inviting to give his reflections a colleague of mine at the AUDA-NEPAD, Ibrah Wahabou, who is our head of infrastructure and the transport unit. Ibrah, please come in, sir. Hello, Ibrah, are you still with us? If you are muted. Okay, I think Ibrah might be having a connection issue, ladies and gentlemen. In the meantime, I will head into our question and answer session. And at this juncture, allow me to say that we are going to open up the Q&A for the audience at the latter end of our discussions. But if you do have a burning question that you want to pose to either Dr. Marawi or Dr. Cilliers, please put it in the chat function and I will pitch that question to them. First of all, thank you again to both of you for those insightful remarks. Dr. Cilliers, let me start with you. From your presentation and from what Dr. Marawi has also said here, it's quite clear that both health and water systems are deeply interconnected, but they're often governed separately. So what would more effective or integrated policy making look like in practice?
Thanks very much. Of course, hugely important issue. I think it is very much context specific. I think countries and governments differ in how they manage this. I think what we are trying to create awareness of is the intimate link between health and wash and economic productivity. Very often, policymakers look at this as a purely technical function, and they don't realize that the investment in health, water, sanitation actually has significant economic benefits down the line. And so therefore one can make the argument that this is really something that should be core and center in economic planning. But of course, often it is an afterthought in the infrastructure budget. And the infrastructure budget often deals with large ticket items in which the provision of water and sanitation is an afterthought. And we see much of that, or it's not maintained. And as a South African, I can just point to what is happening in South Africa, where in particular the maintenance of water sanitation over time has not received the necessary attention. So the second important point to make is not only to build the infrastructure and to build it ahead of populations, ahead of settlements, because it's much easier to do that ahead of urbanization than to try and disrupt urban populations once they're already settled, perhaps in a dense informal area, and then to maintain it. And what's happened in South Africa, which has got some of the highest wash facilities in Africa, nominally, it hasn't been maintained, and it deteriorates. And then to fix that takes a tremendous amount of time and money.
Mm-hmm. Just on that point of money, Dr. Cilliers, just to pick up on where you just left off there. But are the current financing models, in your opinion, fit for purpose, or do we need fundamentally new approaches?
I think our colleague from
and maybe, if I may, sorry, Dr. Cilliers, are there opportunities for public-private collaborations as well in this regard?
The first answer to the first question is certainly there's an underinvestment in health and wash. And secondly, yes, there are huge opportunities for public-private partnerships. But that means governments must open to that and allow the private sector to come in and co-fund it. Donors and international business, foreign direct investment is not going to solve our problems if we don't ourselves invest. And I think absolutely critical that we have skin in the game, as they would say. But, you know, these investments take a long time, and we are all struggling to increase foreign direct investment into Africa. It's about 3% of global foreign direct investment comes to Africa. And very often there's very little equity in that investment. All of this needs to change. But the responses of how countries do that, of course, is country specific. But we know that the investment climate, the effectiveness, and how countries are able to partner needs to be eased. We need to look at the ease of business regulations and all of those kind of requirements.
Okay. All very excellent points, Dr. Cilliers. I'll move on to you, Dr. Marawi. And as I do that, if Ibrah is back on the line, please prepare yourself for your reflections on Dr. Cilliers' remarks. I've been informed that you're back on the line, but you'll come in just after Dr. Marawi's questions here. Dr. Marawi, from a disease surveillance and public health systems perspective, how do the report's projections align with what you are seeing on the ground in terms of Africa's preparedness for future health shocks?
Yeah, thank you very much, Mahao. Yes, in terms of disease surveillance on in general, monitoring the health of the population, the report is really aligned, and it flags critical areas and the needs and gaps that we noted every day. And particularly when it comes to the Africa CDC within our mandate on public health emergencies, you see the major drivers for public health emergencies across the continent. Either we are really weak in the health infrastructure, or water and sanitation infrastructure, or there is a climate stressor, or there is a spillover from the environment because we are encroaching to the environment that was not inhabited before. And there are others like other stressors, including peace and security instabilities in the region. For all these are driving towards public health emergencies. And unfortunately, the health system is already overstretched and poorly funded. And I think there was a commitment, the Abuja Declaration, which is not yet met after past 20 years plus. So that is really very, very worrisome. In addition, the health workforce and the supply chain disruption in the health system. And all this really further stresses the health emergency preparedness and resilience of the health system for handling extra stressor like health emergencies and disease outbreaks. So this report really highlights the key driver, like the wash and the gaps that we need to fill. And I like those health and demographic scenario they put collectively to map out across the areas of investment or prioritization of those investments. We, as Africa CDC, we are addressing health emergencies, and primarily the health emergencies are really like patching the system when the system leaks, like a roof, a carpenter that is patching the system. But the system primarily need to be worked out very well, clearly, with good health infrastructure, prioritization of primary health care down to the last mile, not the capital kind of, in the capitals kind of, rather to the last mile. And developing an uninterrupted supply chain. I think he mentioned also the over 90% of our vaccines are imported, and our estimates is even higher. All these need to be really handled within strengthening the primary health care system. In the meantime, the water and sanitation and environment ministries or actors on that space need to also intentionally invest in that. That is the main or a pivotal investment for disease prevention and economic development. Let me stop there. I think this thing is really very broad. We can't finish it now here. Thank you.
Thank you so much for those insights, Dr. Marawi. I will now hand over to Ibrah. if you could just give us, and I will cut your time in half, in 2.5 minutes, what your reflections are of the report that Dr. Cilliers presented before I pose my question to you. And let me apologize on Ibrah's behalf. He is on mission in Accra, and I'm told that the internet connectivity there isn't cooperating today. Please, Ibrah, please go ahead.
Thank you very much. I'm in Abuja here in Nigeria, and it's due to power outage. Whenever the electricity went out, the Wi-Fi has to restart. But I would like to thank Professor Cilliers for really giving us a very much evidence-rich picture of where the continent stands on this matter. And based on the finding from the report he presented, I would like just to share 3 perspectives from AUDA-NEPAD. And those perspectives sit in the intersection between alignment continental policies, investment mobilization, and institutional accountability. So the first element is relating to the WASH investment gap. So the investment gap and commitment in the water and sanitation sector. As you have heard in the presentation, the reports tell us that inadequate WASH on the continent cost us pretty much 5% of annual GDP, and then more than the continent receive in development aid. And we also read from the report that every dollar you invest in climate resilient water and sanitation can return at least $7. So if those numbers are credible, which I'm 100% believing they are, then persistent underinvestment cannot be explained by lack of knowledge or by lack of money. This is a governance failure, we have to call it. Within the PIDA framework, the Program for Infrastructure Development on the continent, we have identified water and sanitation as a cross-sector priority. Again, in February this year, the African Union adopted a new Africa policy vision up to 2063, which specifically called for that integration of WASH into domestic resources and resource allocation. So the policy consensus around this matter has been here for years, for decades. What has not translated is the enforcement architecture. There have been a number of conversations around the recent development in the humanitarian and global development resource shortcut that it has created vulnerability on the continent. If I take the example of USAID, there has been projection that up to 2.5 million additional deaths can occur consequence to this kind of resource outreach. But this is not a consequence of the changing of the global landscape of financing of development, but it's rather a result of over 25 years of building health and WASH system on donor dependency rather than on domestic and fiscal commitment as well as institutional resilience. So from AUDA-NEPAD perspective on this point, we need to go beyond how much investment we need to who is accountable to mobilize this investment and through which institutional mechanism. The second point is about the double burden that demands a new investment architecture, not kind of vertical programs. In the report you have read, we saw it that cardiovascular disease now rank among top 5 causes of death in all of 55 African countries. And sub-Saharan Africa is basically approaching epidemiological transition at lower income levels, weaker institutional capacity, and higher population growth than any other region, and then we have never navigated before. So the conventional policy response has been, I would say, vertical. More HIV program, more malaria program, more treatment, more TB treatment. There have never been this kind of horizontal coherence among those vertical intervention. And they have delivered real gains. We have to accept that. We have to acknowledge that. But they have not, they have also produced a kind of fragmentation and the donor dependency I was referring to. The scenario that Professor presented requires an additional $19 billion in health spending 2027. The critical question is not how to raise that number, but the critical question is what architecture should govern that process. And I think that where the contribution of AUDA-NEPAD can be valuable in providing framework that already embed this integrated logic in programming. I will wrap up and finish with my last point, which about alignment with the continental agenda, so that we move from the forecasting to really find a way to enforce our commitment. The scenario, again, because I will still come back to it, the scenario is powerful. It's powerful precisely because it's conditional. 41 million fewer extreme poor Africans, it's good. A $79 billion larger economy, it's good. Life expectancy at over 73 years in sub-Saharan Africa. But only if intervention begins as early as 2027, and only if those interventions are sustained. So this is not a forecast, and I would really like us to appreciate that this is not only a research or intellectual conversation. It's fundamentally a policy challenge that Professor Cilliers is putting forward. It's a policy challenge, and Africa has already the normative architecture. Like I was referring to the Africa Water Policy and Divisions. I think the doctor has referred to the Abuja Declaration, about 15% health expenditure. We have the Program for Infrastructure Development in Africa, etc. What is lacking is compliance. The Abuja Declaration was adopted a quarter century ago in 2001. Yet very few, less than 10 sub-Saharan African countries have met the recommendation in terms of health spending. So AUDA-NEPAD role, I think, is to bridge that bridge, transitioning continental commitment into national investment plan, peer review through mechanism that exists, monitoring through the regional economic community. And maybe to conclude, I would just emphasize on what Professor was also saying in the closing of the report, is that incremental change will not be enough. Okay, we fully agree. And the tools for the transformation already exist. What is required is the political and the institutional will to use them. And I think that where institutions that are beyond, I would say, national or regional and continental institutions can play a role in making that happen, but also making sure that it's legible, measurable, and accountable. Once again, thank you very much to you, Mahao, and to Prof for sharing these conversations. Thank you.
Well, thank you so much for those insights, Ibrah. I'll let you go on because that was a lot of food for thought that you have just given us. But Ibrah, I think what a lot of our audience will be asking themselves is that there's this very clear return on investment in terms of WASH. You mentioned that every $1 investment leads to about $7 in terms of return, a minimum, and Dr. Cilliers touched on that in his presentation as well. But does it really boil down to just a governance gap? I mean, you touched on financing, project preparation, and the need for coordination. Why is it so? Why are national governments not waking up to this reality?
Thank you very much. And I think it wouldn't be fair to say they are not waking up to the reality, maybe not enough. So, and to address your question, two perspectives. The reason of that, number one, it's in terms of prioritization, and number two, it's in terms of the governance. I will start with the issue around prioritization. And we have been saying it for years. Water and sanitation has been seen as a social sector. In many of our countries, it's the social development ministry that is responsible for water and sanitation. If that has a huge consequences in terms of prioritization, resource allocation, and advocacy. What we are saying is you need to see water and sanitation as fundamentally an economic enabler. I think the data speaks for themselves. If you see water and sanitation as an investment asset class or a potential investment asset class, then you will start opening up and then start having a conversation the same way you are having in the energy sector, because you can generate money through that. So this is in terms of the prioritization. Now, second, in terms of the governance challenges, I will start from the end. So generally what we observe is there is no enough funding for the sector. And then they will say, yeah, public sector cannot do it alone. You need to bring private sector and blended financing, all the jargons, you know. And then when you ask why we do not have enough private sector in that, they will say, no, because you do not have a bankable project. And then what makes a project bankable? There's a bankable project is a project that is well prepared, whatever that means. A project that basically you need to make sure that you identify priority intervention in the wash sector that are carried by tangible project, where you will structure them enough to convince someone that if you put $1 in this drinking water supply, you have the guarantee of a return on your investment over years, and then a stable environment that will not disturb your investment. Which brings me to the upstream conversation around creating enabling environment. So how many countries do we have that have public-private partnership framework specifically for the wash sector? How many countries that have adopted that framework? How many countries have liberalized the sector, for example? And what is the mechanism that govern that? If you create the enabling environment, you will be able to identify the priority project, and then you can open the conversation with the providers of the capital, so that you can have the necessary resources to finance. And there is example on the continent. When you look at Cote d'Ivoire has been running PPP in the water sector since the Hello? Yeah, I think I'm back. So I was saying there's an example to conclude. There are examples.
Just kindly wrap up.
Yeah, I'm
Ibrah.
wrapping up.
And if maybe in the last 30 seconds of your remarks, if you could touch on specifically how PIDA, and this is the Program for Infrastructure Development in Africa within the AU, better accelerates bankable WASH projects.
Thank you very much. Specifically for the water sector, we have the AIP, the Africa Investment Program in the water sector, which is a PIDA program. And it's made of over 80 projects in the water and sanitation sector that we gather through submission from the countries. We take those projects from initial screening in terms of enabling environment, need assessment, pre-feasibility, feasibility studies, and financial structuring. We do that through strategic partnership, and we have an instrument within AUDA-NEPAD, which is the service delivery mechanism for project preparation, which many of our countries are aware, unfortunately not too much for the water sector, but for the other infrastructure sector. Thank you very much.
Thank you so much for those remarks, Ibrah. I am now, before we head into the Q&A session, I'm going to pose one last question to you, Dr. Cilliers and Dr. Mahao. And if you could just kindly encapsulate your responses to those questions in 2 minutes. That I think these are very burning questions that probably all of us have. Dr. Mahao, to you, how can Africa better institutionalize early warning systems and rapid response mechanisms?
All right, thank you, Mo. Yes, one of the, I think the core competencies that we are working on as international health regulation for health emergency preparedness is these core capacities. And we are here in Africa CDC and across member states, we are setting up such a mechanism for rapid response and surveillance enhancement. A lot has been worked on. As a rapid response, we need like medical countermeasures, deployable staff, and flexible funding, which we are currently working on as Africa CDC and with what we call it African Volunteers Corps. These are the deployable experts whenever there is emergency needs that is a workforce need, we deploy multidisciplinary team of experts across the continent. By the same token, we are also assisting member states to establish such kind of national rapid response team. We have a full program on that one currently working on, and so on. When it comes to early warning, we are currently working and also enhancing member states' capacity on surveillance and also disease intelligence and different systems that we are currently rolling out, including the indicator-based surveillance, event-based surveillance, and wastewater and environmental surveillance, as well as data integration from climate and environment, from remote sensing for better prediction and forecasting of health emergencies across the continent. These are some big initiatives that we are currently working on, and a lot of actors are here. But I really want to re-emphasize that all these are really need to be worked out from the last mile up, not from top down. I mean, and that system should be worked out from the last service point, health center or health post. Yeah, thank you.
Thank you so much for that, Dr. Marawi. In keeping in this sort of solutions-focused question, Dr. Cilliers, I leave the big one to you before I open up for the rest of the audience. Now, if you had to prioritize one investment today to significantly improve Africa's health resilience by 2035, what would it be? What would your key recommendation be to policymakers on the continent?
I think it would be to improve access to potable water, because that provides the vehicle for all the other improvements that we were speaking about. And of course, that is expensive and difficult to do, particularly in the rural areas, but we don't need national schemes. There are all kinds of local solutions that can be pursued in this regard.
Thank you so much, Dr. Cilliers, for those short and sweet and succinct remarks. I now have the pleasure, ladies and gentlemen, of opening up the floor for Q&A from you who have taken the time out of your schedules to join us. Do feel free to just unmute yourselves, and you will be admitted to make your intervention. But before I do that, we do have a question from David Nyirenda, who says that he knows that the Zambian government has pledged itself to produce cholera vaccines for the continent. But which other countries are doing this, and how can Zambia and other countries with this initiative be helped to fulfill their objectives? I think that one is for you, Dr. Marawi.
All right, thank you, David. Good. In Africa CDC, we have what we call it local manufacturing, a department that really supports on health product for local manufacturing. And countries across the continent, they have been sensitized, I think, learning from our COVID experience. I think the report also mentioned like vaccine apartheid or something like that across. And yes, we have been really struggling during medical countermeasures to get medical countermeasures during the COVID-19. And one of the flagship program for Africa CDC now is local manufacturing for diagnostics, vaccines, and therapeutics across the continent. The whole department is working on this one and also on pool procurement. The principle is very easy. I think we are 1.4, 1.5 billion population. This is a huge market. And all the medical products that we are currently importing are imported either from Southeast Asian countries and so on and so on. And while the market is here. So we are currently working on a capacity development, tech transfer across from the existing manufacturers to Africa and interlinking Africa through African Free Trade Agreement network, so that one country produces, the other also should not really produce the same, rather make a connection in the market. And that is what they are working on, market shaping and prioritization. This has really good traction, and there was a big initiative and support from Gavi for African manufacturers, over 1 billion facility to support that one. I think the whole narrative is there. I will leave that one to have a further look into that document and reports in Africa CDC. But David, as you said, it's really, yes, His Excellency, the President of the Republic of Zambia, is also a champion for cholera control across the continent. And I think that is a huge initiative that we are really encouraging. Other countries are also coming. I don't want to mention some because this is but we are really working to support that vision as Africa CDC. Two things. One, to have a tech transfer so that they have the capacities to produce. Two, link with market space, creating other countries also to have a local procurement. I think that is also another area that we need to work as a continent. Locally produced products should be taken by ourselves, not like, So we will be working on that area. And this is a lot. Thank you. Let me stop there. Yeah.
Okay, no, thank you so much for that, Dr. Marawi. And it's quite encouraging to hear that there are states on the continent that are looking to lower that percentage of vaccines that we import and seeking to manufacture domestically. I believe the figure that was given was that it's over 90% of vaccines that we import. So this is quite encouraging to hear. We do have another question. And this one is from Linda Nene. And his question, or her, forgive me, I'm not sure your gender there. Now, there is often limited appetite to involve the private sector in health financing due to the high upfront investment requirements and concerns that the potential privatization of essential health and WASH infrastructure may pose, raising fears that public health outcomes may become secondary to profit. Now, these concerns are heightened by the private sector's preference for shorter profit turnaround cycles. How can these competing priorities be balanced at a continental level to ensure both sustainable financing and the protection of public interest? I don't know who would prefer to take that one between yourself, Dr. Cilliers, and Dr. Marawi. But I suppose, Mr. Jakkie, please go ahead. I see you.
Yeah, I'm not a particular expert in private versus public financing, but this is a problem that we face across many areas in South Africa, in Africa, amongst others as well. I think the problem that the problem is what we referred to previously as bankable projects and so on. I mean, the reality is we need to improve the investment climate in Africa, so that the private sector invests, that we get equity investment on the continent, and that we also deliver efficiency. I cannot really say more than that.
Anything to add to that, Dr. Marawi?
Yeah, thank you. Thank you. I think we also recently published health financing in the new era with, I think, the Director General of Africa CDC has been advocating for that document. That is a green document that you may have seen. And there is three kind of approach that is was proposed in that document. I will refer that one. But I think what we are really trying to do, yes, a private sector, a quick turnaround with yeah, that is really what our colleague was earlier mentioned, like how can we make it a bankable? I think vis-a-vis that, we also need to have a risk protection mechanism that we can really bridge. Sometimes local manufacturing is easy to say, but when it comes to real actual investment, upfront investment is really huge. And we in Africa CDC, telling our experience, during the COVID-19, we were trying to buy diagnostics from one of our countries in the region in Africa, in Northern Africa. We want to buy from Morocco. But the cost that is coming from China at that time was like twice lower than that of, I mean, the Morocco cost is twice higher than that one. And that is because they have put a lot of upfront investment. So I think the AVMA, the African Vaccine Manufacturing Accelerator, was meant to bridge such kind of cost differences. Maybe such kind of risk sharing or kind of bridging, also creating market space and so on, can encourage more private sector engagement in the health sector. When it comes to particularly wash and so on investment, I am not much into that, but I think maybe Ibrah can really give us more insight on that space. Thank you.
Thank you so much for that, Dr. Marawi and Dr. Cilliers. We have another question here from Paresh Kalatia. And the question reads, are there any countries that have policies on waste to resource recovery? He adds that they are involved in large-scale processing of solid waste. Are there opportunities for such projects where one can generate waste to fuel and organic fertilizers through compost? I think maybe that one is related to, that's one that you can answer, Ibrah. But specifically on the question of whether there are states on the continent that have policies on waste to energy, waste to fuel and organic, sorry, let me just see that again. Waste to resource recovery or energy production.
Thank you very much, Mahao. I think the short answer is yes, and the trend in terms of urbanization on the continent, and you see the pile of even household waste that keep coming and coming. It's natural that we have to proceed to waste to resources recycling, and Ethiopia has been the pioneer, I think, in terms of waste to energy. Ethiopia has a waste to energy plant in Addis Ababa. It's the first kind in Africa. Of course, South Africa, which is the leader in the market of recycling on the continent. Rwanda has a clear policy-driven recovery. 2 years ago, we were discussing with the city of Kigali in producing methane, basically, from the city's landfill, where they have the waste, the municipal waste. And I'm sure the project currently is more advanced. They have been discussing on PPP structuring for the project. So Ghana also, they have a waste recovery platform. Nigeria is expanding into industrial scale. So it exists, and happy to reach out to the gentleman or the lady who's asking the question to continue the conversation. Thank you.
Yeah, thank you. Then to Prakash, do feel free to reach out to AUDA-NEPAD regarding further details around that. To Dr. Marawi, what do you think about the accountability of health systems? Most of the health programs like HIV, WASH, malaria, are often announcing urge budgets, but on the field, the results are not evident. How can we talk about resilience since the local populations are not mentioned in recommendations quite often? This question is from Jibril Kasongo, and I will have to say that will be the final question in the interest of time. Apologies to other people who have posted questions. I think that might be all the questions in the chat function. Dr. Marawi, there's a question there on accountability.
All right, good. Thank you. Thank you very much. Maybe Jibril, I think you may have referred to a recent report from Africa CDC, particularly after the decline of the ODA, over 70% decline over the last 2-3 years, and significant strain across the continent. But Africa CDC want to see how much is really the gap and how much was really used in actual sense, and a significant amount of inefficiencies were reported. And I think that is what the Director General of Africa CDC was referring to, like ghost workers, inefficiencies across ghost workers, across procurement, and so on, different areas that significantly compromise the health financing. And that is the governance that we need to address, particularly in health financing and program sustainability. Yes, ODA has really helped us, but it also it gives us like the complacency, like to leave it for others to invest rather than we take ownership. I think that has now pushed itself into the table of the leadership across, and it is coming and it's getting traction. But in the meantime, while this is an invest on financing and accountability that we're mentioning, really on restructuring and investment prioritization of the health sector is always community centered. It should be from the community. And I think, and maybe in the recommendation, if the report you may have seen later or you may read, I think one is even rather than investing in WASH and primary health care services was a big recommendation in the document. And I think that is the way forward. And everything begins in the community and finishes in the community. And that is the recommendation that we are really pulling now across the board. And we have different initiatives for primary health care in Africa CDC and beyond. Yeah, thank you.
No, thank you so much, Dr. Marawi. And if there are any other questions that I might have missed in the chat function, the fabulous teams at ISS will be capturing those questions, and they will inform future research and reports that we will be undertaking and other installments of the webinar series. So do not feel that there's anything that will be lost from today's discussion and your inputs as well, the audience. But I will wrap up with what isn't a question, but a policy recommendation from Arnold Wendroff. And he says that the handcart as a means of transporting water from source to home is also applicable to all other local transport needs. They can be manufactured in Africa with imported Chinese wheels and local lumber and labor. As the modal means of water transport is head loading, the handcart multiplies the amount of water that can be transported at one time while reducing the burden on women and girls. Google Malawi handcart project for further details. Thank you so much for that, Arnold. And ladies and gentlemen, this unfortunately brings us to the close of what I believe was quite an exciting and fruitful discussion. As we come to a close, I think we can all agree that today's discussion has reinforced a simple but powerful message. Africa's prosperity will depend heavily on how we invest in its people, and that begins with health and water security. What is clear is that the data gives us direction, the challenges are known, and the solutions, while complex, are within reach. The real question is whether we can move faster, coordinate better, and invest smarter. On behalf of the African Union Development Agency and the Institute for Security Studies, I would like to thank all our very distinguished speakers for your insights, to our partners, and to all participants for joining us today. We look forward to continuing this conversation throughout the Erudite series, and we hope to see you again very soon. Thank you and have a wonderful afternoon. Thank you so much.
Thank you. All right. Bye.